What's going on, guys, and welcome back to the podcast. Today, we're taking a look at a controversial topic, and that is chiropractic care versus physical therapy. Now, before I dive into that, please don't forget to like, comment, subscribe, leave a review, do whatever it is that you need to do in order to help share this podcast, the world's okayest physical therapist podcast, in order to help educate people on how to navigate the medical environment. That's my intent. That's my purpose. I am learning how to better navigate it myself, and you are all along with me on this ride. And I'm hoping that you get to learn from me as I learn to navigate it as a almost 1-year-old physical therapist. Now, as I said, my name is Dr. H. Let's jump into the differences. Well, number one, physical therapy is focused on movement dysfunction, rehabilitation, pain signs. Basically, physical therapy is interested in helping you improve your range of motion and your strength and to get you back to being functionally mobile. And the way that physical therapy is interested in doing that is, of course, exercise, stretching, hands-on therapy, heat, ice, not yeet. We don't yeet. We use heat and ice. And electrical stimulation, ultrasound, and education. And we work on what's called the evidence-based and biomechanical models. Evidence-based meaning that physical therapists will be doing something, an exercise or an intervention that is reflected in literature. It's in scientific papers as proven effective instead of just doing something that is not proven by literature, right? So no physical therapist is usually going to make up their own idea and their own approach and try that on a patient. They're going to be doing something that they've read in the literature or they know from the literature is effective in order to help that patient with that either impairment or limitation or dysfunction. And biomechanical model just means that the physical therapist is looking at the body in the sense of it is mechanical. It is a mechanical system. You have you have joints made of bones, muscles, ligaments, and tendons. And the way that the joint moves is the way that your body moves. So how your ankle moves, how your knee moves, how your hip moves, how your shoulder moves, how your spine moves are all very important to understand with the muscles and the bones, as well as the neurological component, because that ends up becoming how your body moves through time and space. So there's an issue for your brain sending a signal to your muscles to move your body. That's a problem. And if your actual joint or muscles are impaired and limited, and that's why you don't have good movement, that's also important. And that's what the physical therapist is interested at trying to affect. Meanwhile, a chiropractor is interested in spinal adjustments, alignment, and nervous system regulation. And they are predicating this on the idea that a misalignment of the spine is what's affecting your health and causing your impairments and your pain. And so they like to use hands-on adjustments where they go in and they provide that high velocity thrust in order to adjust your spine back into alignment. They also like to use sometimes electrical stimulation, ultrasound, and some hands-on soft tissue work and or exercise on occasion, but not always. Now, it might surprise you to know that physical therapists and chiropractors both go to school for anywhere between 7 to 8 years. Now, I know that physical therapists have to do clinical rotations. I don't know that chiropractors do. Both have to take a federal license exam and a state license exam, and both have the possibility of residencies or fellowships for even additional education and training. And as I talked about in the last podcast episode, for physical therapy, there's really three big ones. One being neurological, one being more joint and bone focused, and one being more sports focused. And I'm not sure of any for the chiropractors, but I know that they do exist. And now let's touch on the core philosophy. And this is where things really start to diverge. Physical therapy is focused on, like I said, biomechanics and neurological control. That's where your physical therapist starts. Their assessment and in their mind, that's where they start looking for impairments. And when we treat, we're looking to treat any dysfunctions or impairments through corrective movement, education, strengthening, and stretching. And physical therapy's intent is to work over time. Physical therapy thinks in terms of weeks, not days, and certainly not hours. We're not looking to get you better in an hour. We're looking to get you better in 8 to 12 to 16 weeks. There are very few things that physical therapy can impact quickly in one single session in order to make you mostly better. The only two examples that come to my mind are vestibular physical therapy if you have a very specific condition called BPPV, and pelvic health physical therapy, which the first session is almost always a lot of education, and that can really help a patient with a lot of things. But there's almost always work that still needs to be done in the following weeks in order to actually help get a patient back to what we call their previous level of function and to reduce pain. Chiropractors, by contrast, are looking to do same-day symptom relief. They're going to align your spine, and they're going to try and provide some improved nervous system regulation through their adjustments in order to improve, again, your posture and reduce your pain. So sometimes your chiropractor will tell you that they want you to come back and win, and how many weeks or whatever. And they might even say, hey, your back is so out of alignment, might come every month. But a lot of times it can be a one and done. But a chiropractor is not going to be in this for the long haul per se. It's not baked into the assessment, right? In a physical therapy clinic, it is baked into the assessment that you'll be coming for weeks. In a chiropractic setting, it's much more of, hey, ideally, I only have to adjust you once and you're on your way. But if you're a really advanced case, I might have to see you on the regular. So that's kind of the difference already. PT, you're putting in the work for the long haul. Chiropractors, we're hoping for a one and done, get you to feel better today in the same day. And the treatment styles kind of reflect that. So physical therapy is focused on exercise, right? Strengthening, stretching, balance, working on your walking, working on your running, using needles to reduce muscle tightness and trigger points, cupping to improve blood flow, taping in order to improve joint stability, working on balance training, even all of these things. That's why we have the dumbbells. That's why we have the weight machines. That's why we have those really weird platforms you stand on and they shift around. Physical therapy is going to use exercise and stretching and interventions like that in order to try and improve your range of motion, your strength, your balance, your neuromuscular control. Meanwhile, chiropractors are going to use their adjustments, and they're going to rely on things in order to be able to check your alignment, such as x-rays or some sort of alignment scan. But they also like to use electrical stimulation, and sometimes they use soft tissue tools like Graston tools in order to go in there and improve pain and such. Sometimes they use exercise. I have seen some chiropractors give out a couple exercises here and there, but it's not as common as I think not giving exercise. And again, I think it's baked into the cake for chiropractors that realistically 3 or 4 exercises are not going to keep the misalignment at bay, or it's going to just have to be something that if they get out of alignment, they have to come back. And so here we have to get into the similarities and the differences. Both PTs and chiropractors will treat neck, shoulder, back, and joint pain. Both will use their hands for manual therapy, for hands-on care. I don't know if chiropractors call it manual therapy, but physical therapy does, and so it's hands-on care. Both aim to reduce pain and improve mobility, and both can operate in a variety of environments, such as cash-based, which is where you just pay cash, or insurance-based, where you just pay insurance. But both kind of exist in the same market spaces of either cash-based or insurance-based. Also, and this is where it gets kind of murky, there are physical therapists that do what are called high-velocity, low-amplitude thrusts that on the surface may appear like a chiropractic adjustment, both in their setup and in their form. And this is where it gets a little bit touchy, because physical therapists do not do adjustments. Physical therapists do manipulations. and chiropractors do adjustments. When a physical therapist in a setting where it is legal, they have been trained to do so, and they are not violating any sort of laws or anything like that. And that sort of setting where a physical therapist is allowed to do it, they can do a manipulation. A chiropractor is always going to do a manipulation, but a PT might not. And in fact, even if a PT is trained to do it, went to school to do it, has all the education and stuff and knows how to do it, a lot of times the PT will opt not to. They won't. Either because they don't think it's as effective, or they don't have the time to do it, or it just doesn't pertain to whatever it is that they're seeing the patient for. So if a patient comes in for shoulder stuff, the PT is not going to go, you know what you need? You need a high velocity, low amplitude thrust manipulation to your thoracic spine in order to improve your shoulder pain. Most PTs are going to be like, let me work on your shoulder, bro. I'm just going to focus right on this. Versus a chiropractor, where it's their bread and their butter and their purpose for existing, they're going to give you an adjustment. A lot of PTs, even if they learn how to do manipulations, they will never do them once they graduate. They just choose not to. So that's an important similarity. The difference is PTs are focused on active recovery, and it's movement focused. It's the biomechanical model. It's how do I get you back to doing what you're doing? We're in this for the long haul. We're in this for weeks. And the chiros are more interested in alignment, getting you back into alignment, doing the adjustment for you, and then getting you back out of the office same day, hopefully feeling less pain. Another key point is, like I said earlier, PTs are really, really, really focused on doing whatever is the most evidence-based treatment. They are focused on, hey, what does the literature say that is the best for my patient in order to help them with this condition or this impairment? I think, generally speaking, chiropractors are a little bit less on the research as much as PTs. And that's not to say PTs are the best. There are a lot of PTs that are using very outdated information out there. But by and large, PTs are trying to figure out what the most cutting edge treatment should be. And I think chiropractors are, I don't think they're quite into the literature as much as physical therapists are. I think they tend to have their well-honored and what am I trying to say? They have their relied, tried and true traditional model that they're going to rely on instead of the most cutting edge evidence based, just because, chiropractic care has been around for so long, and you focus on those adjustments and those cavitations. How much is that really going to change over time? Versus for physical therapy, if you have a patient come in, they have a very specific type of ACL repair with a very specific protocol that's designed to get them back onto the field in 10 months. And this is a cutting edge type of surgery with a cutting edge sort of understanding of how to get them back onto the field using very specific sorts of exercises, interventions, and modalities or whatever. That's where you can see PTs are going to rely on the research a lot more than a chiropractor. Chiropractor's like, you have back pain? I'm going to do the same thing that we've been doing for the last 20 years to help you with your back pain because we know this helps with back pain. A PT is going to be like, yes, you have this condition, but this is a new type of surgery or a new sort of thing that hasn't been around for the last 20 years. It's only been around for 10, and we're still trying to flesh out what the best exercises and interventions are to get you back as quick as we can to your previous level of function. So that's just a little bit by the nature of the two. PTs being involved in surgery, of course, they're going to be having to focus more on the literature than chiropractors, who typically are not, right? In fact, I don't know of a single chiropractor that's someone who recently had surgery that would go to them and say, I want you to do an adjustment on me. I feel like the chiropractor would be like, no, you just had surgery. Get out of my office. You have to heal first. So that kind of leads us into, when do you see one versus the other? After you had a surgery, you're going to be going to a PT. If you need a movement analysis, working on your gait mechanics, your walking mechanics, if you need strengthening, active range of motion, improved active range of motion through stretching, and if you need long-term progress, if you know it's going to be a long haul, it's going to be a PT. And if you need to fix a misalignment same day, right? If you're like, hey, you know what? I just want to have my misalignment taken care of, you're probably going to go to a chiro. And this is where I kind of want to end. I'm going to try and end in a reasonable time. Because as a physical therapist, I see patients that are also seeing chiropractors or have recently seen chiropractors all the time. And um, I will supplement that by also saying a quick story. Um, I have had patients where they would come into the clinic being told by their chiropractor that they had scoliosis or they had a severe misalignment. And after I worked with the patient and I saw how tight some of their muscles were in several places, and I worked with them, I became kind of, and this is where we get into the diagnosis part that we talked about last time. I became less and less convinced that they would likely be diagnosed with scoliosis. And as I talked about with the last podcast, when I get asked point blank, do you think I have scoliosis? If they don't have a diagnosis, I can speak freely and say, hey, I don't know, but I don't think so. And here's why I don't think so. And for a lot of the cases, not every case, if someone has scoliosis and I do my special tests and I think they have scoliosis, I will tell them, yeah, I think that you probably do. But again, my job is not to diagnose. That's your doctor's, and they're going to go about it doing X-rays and measurements in the clinic and this, that, and the other. It's not my lane to diagnose, is what I usually tell people up front. But also I say, hey, not my job to diagnose, but also I think yes, or also I think no. And here's why. So anyway, I've had patients that have come in and they just had very tight muscles everywhere, like extremely tight muscles. And after doing a lot of work with them, their muscle tightness would be reduced and their spine would have less pain, and it would also be more symmetrical and look less like they had scoliosis. And um, their chiropractors would tell them, you have scoliosis. And in fact, they would say, you need to have an x-ray done because I am like 99% sure you have scoliosis. And they would go and they get the x-ray and it would come back negative. And then while I'm still seeing the patient, I would get a letter saying, hey, I know we're treating the same patient. I know that I told them that they had scoliosis, and you told them that you didn't think that they had scoliosis. Um, Yada 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 yada. Basically, I'm looking to keep this. I'm looking to work with you to help this patient get better, and that's the right approach. The long story short of this is sometimes, and it goes both ways in the medical system. I, as a PT, can say I don't think you have scoliosis, and the patient comes back and they do have scoliosis, and then I have egg on my face because I misspoke, right? Um, the problem is when um, this happens and you have any sort of medical professional involved in treating a patient with another medical professional, um, there can be times where they look to more firmly assert their positions or their hypotheses over the other. And when they're wrong, it complicates things a little bit because it then might cost you that relationship with a patient. Now, as a PT, I am never going to tell a patient, don't see chiropractors. And I would hope that chiropractors would also not be telling their patients not to see physical therapy. But there is definitely a historical tension between chiropractors and physical therapists. And that can definitely muddy the waters when it comes to giving patients the best care. Because, again, the disciplines are a little bit different and their intents are different and their philosophies are different. And that just increases the likelihood for a little bit of friction. But all of that to say, if a chiropractor and physical therapist are both treating a patient and they are both wanting the best for that patient, and they're both trying to provide the best care for the patient, that patient can only benefit. So all to say, yes, there is a history of that tension. Yes, there is, because of all those differences I highlighted, that people can arrive at completely different conclusions and different ideas of how to go about it. But the fundamental baseline should be that they're at least communicating with each other and trying to provide the best care for that patient, which is what happens for mine. Because I am not going to be the sort of PT that goes, haha, you thought this was scoliosis and you were wrong. Clearly I was right. I'm going to steal this patient away from you forever. That's not my goal. my goal is to just help my patient get better. And if they like to go to a chiropractor, get their back adjusted once in a while because they think it really helps with whatever sport they're doing, I'm not going to tell them to stop. So I hope that story helps a little bit break down how easily it can reach into that tension, and how if your healthcare providers aren't careful, they can definitely get into a little bit more of a I know more than your chiropractor does, you should trust me, or the chiropractor saying, see, I was right, you do have scoliosis, your physical therapist doesn't know anything, you should come to me. Because whether we like it or not, in the medical system, it's almost always about who's right, and that can definitely feed into people's egos. And when you have two professions, like I said, that already have a history of not getting along, and you add ego into the mix, that's where things can get really, really messy. So, not that it's super common, not that I've seen it happen all the time, but as long as both of them are focused on providing the best care for their patient, I've seen it work out fine every single time. So, this has been the difference between chiropractors and physical therapy, their philosophies, their approaches, their treatment styles, and a little bit into the tension that exists between the two. So, thank you so much for listening. Please don't forget to like, comment, subscribe, share with your friends and your family. And as always, everybody stay healthy, stay fit, and stay awesome. And I will catch you all in the next podcast.